Welcome all to the Patient Education and Empowerment in Dermatology webinar hosted by See My Skin and Dr. Michelle Henry. See My Skin is a result of a long-standing partnership between Vaseline and Hued, with a shared goal to create a space that further meets the skin health needs for people of color. We want to be a resource for education and connections with skincare providers who specifically understand the cultural, physical, and mental needs of patients of color. We are excited to learn from Dr. Michelle Henry, who has had international success as a speaker, trainer, and author, specializing in high-risk skin cancer treatments, cosmetic surgery, hair loss, skin rejuvenation, and skin of color. This webinar is co-hosted by Dr. Michelle Henry, a board-certified dermatologist, and See My Skin, a partnership powered by Vaseline and Hued. By viewing this webinar, you agree to the following terms.
Hi everyone, I'm Dr. Michelle Henry. I'm a board-certified dermatologist and dermatologic surgeon. I am based in Manhattan, New York. I'm the CEO of Skin and Aesthetic Surgery of Manhattan, and I'm also a clinical instructor of dermatology at Weill Cornell Medical College. As a part of my practice, I have the pleasure and privilege of treating many men and women of color, and so the importance of patient education and health equity is it's really near and dear to my heart. So I'm thrilled to be here today with Hued and with Vaseline, powered by the See My Skin platform, to talk about patient education, health equity, and how to make sure that you make that a very important and critical factor in your practice. So let's dive into it. So we all know that significant disparities exist in dermatologic care for Black patients. And Black patients make up about 13% of the US population. Black patients are overrepresented in certain aspects of dermatology, underrepresented in others, but it's really important for us to be able to recognize that and educate our patients in ways that meet their needs, and also empower them to advocate for themselves, so they're always seeking out the best culturally appropriate care. And why is this important? How do we do this? So there is the immediate impact of culturally appropriate care, and then there are the long-term impacts. So the immediate impact is that improved disease knowledge and self-management. So if these patients truly understand what they have, they know how to identify it themselves, they know how to advocate for themselves if they don't have a Black or brown or culturally competent dermatologist to help them. They have, in understanding their disease, they're also more likely to have compliance. They're more likely to feel empowered to treat a lot of the chronic diseases that we see in dermatology. And so what we find is when a patient truly understands their disease state, we get more medical adherence. What's a long-term impact? So in conditions that may have a more severe or grave outcome like skin cancer, when patients are educated appropriately, they're more likely to find it. And so we know that early detection is so critical in conditions like skin cancer, but early detection is really important in most conditions. When we find it at a least severe state, we're much more likely to get it under control, to treat it appropriately, for the patient to have better outcomes and to have an overall better quality of life. And this is true not just for skin cancer, but for conditions like keloids, vitiligo, lupus. And so really this helps us to reduce those healthcare disparities when we educate and empower patients ourselves. So what are those barriers that make it more difficult to teach this patient population? One, health literacy is a huge problem. So this is a study, and here they're really looking at heart failure, but heart failure, we can also extrapolate from that to dermatology, and they found that there is a huge gap between health literacy in Black and brown patients and in white patients. So in this study, they found that Black and brown patients are disproportionately affected by low health literacy, with 24.4% of Black patients having poor health literacy compared to 9.7% of white patients. And this is even after adjusting for factors like education and income. So because of this, many of these patients have suboptimal adherence rates. They don't understand. Something else that often complicates understanding with these patients, language barriers. So a lot of our Black and brown patients come from communities where English may not be their first language. And that lack of proficiency obviously will compromise their lack of understanding. And so it's critically important that in these patient populations that we have appropriate translation services. So I always have a translation line with appropriately trained translators to make sure my patients understand, and I have them repeat it to me. Socioeconomic factors play a role. So, socioeconomic status is closely intertwined with race and ethnicity, and this further complicates health literacy for a lot of Black and brown patients. In communities that are segregated by race and socioeconomic status, there's often low economic development, lower education. We have lower social services, rates of social services, less integration into a community where they can seek out these social services to know that they're there, and less of an ability to advocate for themselves. We have mental health implications. So, wealth plays a role in explaining the racial differences in depression. But we also know that Black and brown individuals have higher rates of post-traumatic stress disorder. And a lot of this is racial trauma. So that racial trauma, those macro and microaggressions that we're dealing with every day, we see time and time again reproduced in communities of color that this plays a role in mental health. And then patient-provider dynamics play a huge role. So we know that given the historical injustices we've seen in this country, that Black and brown communities have a level of hesitancy, which one would expect. And it really is our job, even if you are a Black or brown healthcare provider, to really understand this and try to overcome this distrust by really working to strengthen the physician-patient relationship. Something very thoroughly, you want to make sure that you ask, do you have any questions? I ask my patients to show up with questions, and then I invite them that if in this moment you can't think of the questions, write those questions down, send them to my staff. We will help you. I think about those cultural differences. So I have patients because there are unfortunately so few dermatologists. I have patients that come from all over, from Pennsylvania, from Pittsburgh. I think about their travel. A lot of, for my non-Black patients, they may not have to travel that far to see a Black dermatologist, but a lot of our patients do. So when we're making our follow-up appointments, I think a lot about that. I think about providing flexibility so that they can see me and access my services, and really thinking about all of those things that we may not have to think for our other patients that may come from, not all, but may come from, backgrounds with less economic restrictions. All of these things help to reduce the shame that some patients may have in coming to their appointment. It reduces the discomfort. It makes them feel like you are at home. We are seeing all parts of you, and we're considering all parts of you in our treatment plan. So what are some tools that you can use? So again, See My Skin is a really fantastic service. So these platforms help us provide that imagery. When we're looking online at Black and brown skin, less than 6% of image-based searches will show conditions in skin of color. And so here they can search it, they can see it, they can look for those differences, and it really helps to provide a community, empowering them to take control of their disease state. And that gives them pride in getting to their cure. And again, it helps us reach our number one goal, which is compliance, adherence, and patient satisfaction. Something else we can do is encourage more frequent appointments and screening. So I find that my patients, especially with chronic diseases or difficult to treat diseases, they do a lot better when I give them homework, and then we have a test. So I give you homework, the test is going to come in 2 to 3 months. So it's a much easier to adhere to something. And when you're going to be checked on in 2 to 3 months, then when I tell you, come and see me in a year, use this, let me see you in a year, it makes them an active participant in their care. And I find that I get a lot more adherence that way. We imply a lot of retention strategies. So personalized messaging to our patients. We check on them if they miss their visits. It is all important in creating that community, so that they feel safe, seen, heard, taken care of, and cared for. And all of those things really really contribute to patient compliance. Collaborate with a lot of the advocacy groups. So, a lot of the conditions we treat can be isolating. So I have a lot of patients with alopecia areata. That can be really isolating. Patients with CCCA, central centrifugal cicatricial alopecia. Hair loss, I think especially for Black and brown women, can carry a lot of shame. It can be really isolating. And in these communities, it's easy to conceal it with wigs and extensions and all these things, but that doesn't conceal the shame. And so I think communities where patients can talk about this, things like vitiligo, which is going to be more obvious, but finding these communities, because that isolation and that feeling alone leads to social isolation, and that compounds that mental health aspect, which can sometimes reduce our ability to treat our patients. Collaborating with organizations like the Skin of Color Society, the National Hispanic Medical Association, and really incorporating all of these tools, and leveraging these platforms will help to build trust-based relationships with our patients, and also empower them to be able to help others in their community and seek out appropriate help for themselves. So, what are some key strategies to encourage self-advocacy? Give them a list of essential questions to ask. How does this condition typically present in skin of color, right? Are there any specific considerations for treating my skin type? What are potential side effects of this treatment? If they don't ask it, we need to let them know that we're thinking about it. Encourage them to bring in photos of their skin condition over time, to track it, keep a symptom diary. That really helps a lot, and it helps them to gauge, hey, when I'm using my medication appropriately, I see an improvement in my symptoms. It's really hard when, I have a lot of patients, they'll come into the office and they're like, it didn't work at all. And that means because they're breaking out today and they have forgotten that, in your first month when you were energized and super adherent to the treatment, you felt and looked really, really good. And so that's really, really easy for patients to forget. So really tracking these changes over time in a diary helps. Tell them to research their condition so they can see that they're not alone. And I ask them to express their concerns very clearly and assertively. So when I walk in the office, tell me how you're doing. Okay, on your best day, how are you? On your worst day, how are you? How are you feeling on a scale of 1 to 10 about your condition? And sometimes we even track that number. If last time they were feeling like an 8, and this time they're feeling like a 9, I want to know why you feel worse, right? And I want them to also track why they're feeling worse. That helps us to figure out trends in their treatment plan. Encourage them to request clarification when medical jargon is used. I tell my patients, it's not your job to know, right? So don't ever feel embarrassed when you show up. It is my job to teach you, but it's not your job to know. So don't ever feel embarrassed if you don't know it. Don't ever say it's a silly question. When you go there, feel confident in saying those things, because any physician who cares about you and cares about doing a good job will not feel threatened by you asking those questions, asking for clarification, and ask for it to be written down. I always tell my patients, I'm going to see, maybe 30 patients today, but you're only going to see me today. You're only going to see me a handful of times this year. And so for me, it's, I could handle most visits standing from the door, right? We do this so many times a day. But for you, this is your moment. And you may forget the anxiety in that moment. You may have waited to get to this appointment. So write things down, ask for it to be written down. At the end of your visit, ask the doctor to repeat it for you and repeat it to them to make sure that your understanding is completely sound. And so these are all tools that we can give our patients to handle themselves appropriately. For us, you think about the first time you went to an interview, or I don't know, depending on how you were raised, a very fancy high stakes dinner. You may have not known, like, what kind of conversations do I have? How do I manage myself? I mean, that's a very common feeling. And so I tell my patients, we all understand that. So preparing for that visit is something that you should do to make sure that you're comfortable, you're confident, you're going there intentionally to get your answers your questions answered, and being intentional about that is really important to helping you advocate for yourself and to get better care overall. So we want to focus about, patient-centered care. I mean, that is what we do, patient-centered communication. So look at your patient, considering their educational level, considering how they engage you. So I have patients that are a little bit more restricted. Now, if I come in and I'm like, that's a little bit too much stimulation for them. Like reading them, seeing how they engage, and mirroring that. So mirroring is really important to make a patient feel comfortable, to make them feel seen. So mirroring is a tool that I use a lot in my office. And so what does this mean when we say patiently centered care? So in addition to mirroring, thinking about their background, their educational level, think about their preferences, their needs, their values. So all of these things are really important. Think about, religious preferences. Create an open dialogue. Talk to them about, you've seen other doctors before me. What happened? Why aren't you there? What made you feel uncomfortable? I want to know about their concerns, their beliefs, their experiences. I want to tell them that, this is a safe space. You can ask whatever you want. You're entitled to feel however you feel. Even if you're upset with me, tell me, because my goal is to get you to a healthy place, to a happy place. It's not about protecting my feelings even, right? So don't feel afraid to be critical of what's going on, because together we make this decision. And always highlighting, shared decision making. And so if I'm teaching you to advocate, if that means you advocate against me, that's fine, because at the end of the day, we need to do what makes you feel best, what makes you feel like you are really driving your healthcare. And so these are active conversations that we have in my patients. Again, as we discussed before, when we're talking about our communication techniques, recognize the diversity, right, within all of these communities. Understand that, yes, I understand there are some differences in black and brown skin, but also black and brown or whatever ethnicity is not a monolith. So really avoid generalizations or stereotypes, right? So I've heard people say before, I think that black and brown skin isn't as sensitive because we don't see the redness. Now we know that's not true. We have some very dark skin that is very exquisitely sensitive. We also have dark skin that's not. We have all of the different variations. So making sure, while we're recognizing the importance of those differences in skin of color, that we know that even in recognizing that, it's not a monolith. We're not all the same. Cultural backgrounds are very different. The way I engage, let's say, a black patient from Texas, which is my home state, and a patient from let's say Rhode Island, a black patient from Rhode Island, can be very, very different, right? They have very different frame of reference. The language and references that I use are going to be different for these two populations, because I understand what feels like warmth in certain places may feel unhinged in certain places, and what feels like professionalism in certain places may feel like you're cold and you're not engaging. So really thinking about this as you're developing your evaluation and treatment style with your patients. Again, clear, jargon-free language. We want our patients to know that we are the authority. We know that we know what we're doing, but really making sure that we're staying away from jargon. Again, explaining the medical terms in plain language, providing written materials, and employing visual aids is really important. And then being an active listener. Allow the patient to fully express their concerns. No matter how busy we are, we try not to cut them off. And, be a receptive listener. So listen, repeat your understanding of what they've said, and then validate their experiences and feelings, because they might say one thing and think they're expressing something, but they're not. So let them know what you feel they have said, so you can make sure you're on the same page. Be aware of nonverbal contact. Maintain appropriate eye contact. Use open body language so that they feel safe in that space. And be mindful of their eye contact. If they're not making eye contact, if they feel uncomfortable, that might be a patient that might not be as forthcoming. So ask more questions to make sure you're really diving deep to understand how they feel. Again, address any language barriers. There are many online sources or phone sources that you can use to find an interpreter, and that is very, very useful, because we'll have patients that walk into our office with all sorts of speaking many, many different languages, because obviously New York is a very international city, so this is something we think about a lot. And then using that cultural knowledge and understanding to tailor their care plan. So don't ask them, or if you don't know, ask, what are your restrictions? What can't you do? What would be very hard for you to do throughout the week? So these are really important things to do. Understand those cultural beliefs about skin and hair. Recognize and honor traditional practices, and see what we can do to incorporate our medical plan into their traditional practices. Understand those cultural norms regarding physical examinations, and of course we want to make sure that we give everyone respect. But there are certain cultures that will need an even higher level of privacy, might need an even higher level of maybe a higher level of conservatism. So really thinking about that, and at all times checking in with your patient to make sure we have adequate consent for all of the things we do. Talk to them about treatments and how this may affect their hair and texture and tone, as we've discussed before. If you're giving a patient of color, let's say I'm treating hyperpigmentation, I often tell them, we're going to use this treatment to start the product, but we don't want to overshoot. And if you do overshoot and the area gets a little bit lighter, know that your skin is programmed to come back to the same color. So try to kind of predict those issues, so that they feel comfortable, and it also highlights your deep fund of knowledge in treating this patient population. When you can, if there are family members there, engage the family members when it's culturally appropriate. And really creating a community is really important as well. Address the bias in building trust. So, a lot of our patients, we have, there's a really great book to read called Medical Apartheid. And it talks about the history of medicine in America. And when you look at those sorts of things, you understand why patients may not trust us. Even as a black or brown doctor, they may not trust us. They may think that we are just a cog in a wheel, a tool of the machine. And given the history, you can understand why they would. And so we really have to enter into these spaces with a large amount of grace, a large amount of humility, a large amount of understanding, because I think that there is a huge amount of implicit bias among healthcare providers, including us. And so we want to always make sure we're challenging that, and that we are mindful of that. There are so many studies that show that healthcare providers have these unconscious negative biases around non-white patients. And in these systems, many of us may not be completely excluded from that. So always challenging that to make sure that we are protecting our patients. And even well-intentioned providers have their biases shaped by media and culture, and and TikTok and social media, and we all are in these echo chambers that feed us. And even those of us that are highly educated and very worldly and evolved are not immune to this bias. And so whether that bias is, not solely about race, but maybe it's about culture. I grew up as a Black Southern Caribbean girl, right? And so in certain places, someone may just see me as a Black Southerner, and then I hear, things about, maybe Caribbean people, or someone. I tend to have a pretty neutral accent. So sometimes I'm around Northeasterners and I'll hear criticism about Southern folks. And, so it's really important to think about all the aspects that makes up an individual, and make sure that we're protecting all of those things, and understand how we can all be manipulated in certain ways, and we have to be very vigilant to make sure that we're confronting our own biases at all time to make sure we're establishing trust. Listen to these patients attentively, and take their concerns seriously. Listen to what they're saying. Again, provide a cultural space. Those diverse visual aids, again, as we discussed, are so important. Cultural humility. So understanding that we can't know everything. I am who I am. We try to be worldly people. We try to absorb as much as we can, but have a real high level of humility when we're engaging patients. Ask the questions. We always say that we're lifelong students. We are. We are always learning, not only about medicine, but always learning about cultures, always learning about, how the kinds of products, the kinds of potential restrictions, the beliefs, the fixed beliefs that different cultures may have, and that makes us a better doctor. Patience and time management. The biggest concern, it's hard because we have so many restrictions on ourselves. We know that practicing medicine is really difficult, but try your best to be patient and manage time in such a way that our patients feel seen. I think a lot of patients come to me, especially black and brown patients, they feel like they've been rushed in other places. They feel like that person didn't want to listen, didn't want to do the additional work, didn't want to do that heavy lift to understand them. So that's really, really important. Practice self-reflection. No matter how well-intentioned you are, we're going to do clumsy things. Note them, understand them, examine that in yourself. Find ways to really make sure that when those things happen, that we readily address them and we express our empathy for what's going on with our patients. Because this is all important for them to feel safe and feel like they can participate in the shared decision making that is critical to keeping themselves safe and healthy. Very, very, very important. I think that that sort of mistrust is what keeps so many black and brown patients out of our offices, and this is why we see that so many of the negative outcomes we see in skin of color is because of hesitancy to engage the medical system, right? And so these patients are showing up. We're detecting these conditions much later. We have delayed diagnoses because of that. They're showing up with disease at a later stage. Maybe we talk to them and we don't make them comfortable, so they're scared to come back in. They may come for the first visit, but because we didn't make an inclusive environment, we didn't talk to them about how to follow up, when to show up, when they should come again. A lot of my patients feel like it's burdensome. I didn't want to follow up. I didn't bother you. And so it's for me, I tell my patients, I want to see you because I am invested in you getting better, and we are in this together, and we're on this journey together. And so that kind of language I find resonates a lot with my patient population, because they really, I think in black and brown patients, the importance of community is so critical. And so I always try really hard to make sure that I create a community. I talk about the things that they may have encountered in the past. I think we've all been patients before. I've been a black woman my entire life, and so I remember even as a kid in encountering this bias. I remember once I was having surgery. I had an appendectomy, and I remember the doctor telling me, I'm a doctor and I made all C's in college, so you can be a doctor too. And I remember that just making me feel unsafe and unseen. This person didn't see my own brilliance; they saw just another black girl, and it compromised my trust. And imagine how scared I was when I was going into that surgery. But these little things, these little comments, these little microaggressions really cause our patients to shrink. And so it is our job, those of us who believe in empowering these patients, to stand up loudly and create community for them so they can feel very safe. So what are our key takeaways today? Health literacy is very low in black patients compared to white patients. I think that overall we really need higher health literacy for everyone, but I think especially in patients where historically they have this level of mistrust, so that anxiety because they can't even understand it. They don't want to come. By the time they've gotten there, they don't understand. You can imagine how crippling that is and how that makes them further disengage from the system. So understanding that in our consultation so that we can really address that in a meaningful way with our patients is so important. So we want to make sure that we understand that those differences and that we really teach with that understanding. 2, culturally tailored education improves outcomes for patients of color. So thinking about what kind of products do you use? What have you been taught to use at home? Were you taught to always use antibiotic soap on your skin? And is this why you feel unclean if you don't, while it's flaring your eczema, which is something I see in a lot of communities. A lot of communities are very wet, and I see this in a lot of black and brown communities. A lot of my immigrant communities have this belief that they have to sterilize their skin every day, and now they have this awful eczema, these awful eczema flares because they're using these very, very harsh soaps. So think about that, re-educate on that. Talk about why, your family wasn't crazy for doing that, right? These cultural practices are respected and have kept people clean, especially in tropical, humid environments. But we're not there now, and you're suffering. You are particularly sensitive, so we have to make some modifications. And so I don't pull out those cultural practices; I modify them. So if you want to use, let's say, this soap here, here, and here in these sensitive areas, that's absolutely fine if that makes you feel clean. But how about we try something else in those areas where you're flaring and being really sensitive? So being culturally mindful, making cultural modifications, but not erasing a lot of those cultural habits and patterns, because when they're passed down, not only does it reflect the individual, it reflects their families, it reflects their culture, it reflects their community, it reflects everyone who's loved them before. And so that can be really jarring for a patient when you just fully extract that and say, oh, it's awful, it does not work, right? So thinking about ways that you can tailor their beliefs to what we believe is evidence-based medicine is critically important and helps not isolate our patients. Giving them tools, again, 3, like See My Skin, giving them resources to educate them. I tell my patients, I think education is kind of a part of showing how we care, right? I want to educate you. I want to empower you. I want, when I am not here, that you know how to engage other doctors. You know how to do this for yourself because I care, right? And so that is really meaningful to my patients, and I use that exact language. And again, as our 4th is that it helps to build trust. Trust is what is lacking. A lot of Black and brown patients, and patients in general that are from lower socioeconomic communities, these segregated communities, feel like they have no agency, right? They don't have any control, that the world is pushing them, and they don't have the agency to fight for themselves. And part of how we build trust is not by continuing to perform as the authoritarian, the person who makes them better, the savior in that way, but we make them the saviors by teaching them how to care for themselves, to advocate for themselves, to advocate for their communities, to educate others, to feel comfortable navigating this healthcare system. And I think that's one of the biggest things we can do for our patients, whether they stay with us or not. And again, giving them these tools are so critically important to make sure that that happens. 5, shared decision making. Again, we're not taking this paternalistic kind of approach. We are truly looking to empower our patients, to let them know that this is a joint decision. And if I said all of these things are the best practices and you don't want to do that, you don't have to do that, right? I can give you all of the information that I know is best, and that will help to kind of guide you on a road. And all I am here to do is to give you information, and you kind of decide what direction you want to take, right? And so having that, a lot of patients say, I don't want to do that, and some doctors will shame them. Well, now you've broken the trust, right? Now you've decided that your decisions are better than their decisions, right? We don't always know why they're making those decisions. So shared decision making is so critically important to empower our patients. 6, communication should be adapted using visuals to tailor to skin of color. So yes, when we're educating, we know this, we've all been in school forever. We have many different types of learners, and we know that visual aids can help significantly in educating our patients. We send them home with just a piece of paper. They really can't grasp what's going on. There's still jargon on this paper. So complementing what we give them with visual aids, especially in such a visual profession, is absolutely critical and really takes us to that next step in providing appropriate care for our patients. So that's really important. And then always doing the personal work to always overcome your own implicit biases. And we all have them. No one is immune to it. And again, that bias goes beyond skin color. It goes, into culture. It goes into who we think is more attractive, who we think lives in a way that's different from how we live. Always taking inventory of our own bias so we can make sure that we are protecting our patients. And that goes into the overall humility that is absolutely required and really sacrosanct to make sure we're taking care of our patients appropriately. Creating inclusive environments, for our patients. That's a part of being culturally appropriate. So in my office, we have big TVs that are kind of talking about what we do. I make sure that we have images that reflect Black and brown patients. If I'm bringing in a new aesthetic product and you want me to use your marketing materials, you have to make marketing materials that reflect my patient population, or I'm not going to use it. I don't want my patients feeling like these products, we're retrofitting into them. I want them to feel that they are valid, and they're validated by all the things that we're doing, and that we're thinking about them in all aspects of my practice. And so, we want to make sure that environment doesn't feel foreign to them. So all of these things are really important. In my practice, I am probably 50% patients of color, and so these are the sorts of things we think about each and every day.
Thank you all for joining this webinar presented by See My Skin in partnership with Vaseline and Hued. We invite you to join the See My Skin Provider Directory, a dedicated search tool to help patients across the country identify and schedule appointments with dermatologists who understand their skincare needs. It takes less than 5 minutes to apply and is completely free. Thank you all for joining us today, and a special thanks to Dr. Henry for sharing the valuable insights of her practice. If you have any questions or comments, please send them directly to directory@huedco.com. Thank you all.